Thunder Bay Regional Health Sciences Centre plays a key role in healthcare for the people of Northwestern Ontario. As the only academic health sciences centre in the region dedicated to providing complex, acute, and specialty care, we teach the next generation of healthcare providers and, through the Thunder Bay Regional Health Research Institute, advance medical research. With the launch of Strategic Plan 2026, jointly with the Health Research Institute, we outlined our priorities of equity, diversity, and inclusion, patient experience, staff experience, research, innovation, and learning. These directions, along with supports, will lead us to a stronger, healthier, and sustainable future.
Strategic Plan 2026 is momentous for Thunder Bay Regional Health Sciences Centre and Thunder Bay Regional Health Research Institute. It is our inaugural joint strategic plan, and it is the foundation by which we expect to see significant progress in patient care and health research. It is the foundation for ensuring our teams can provide the best possible health care at all times and ensure that patients are at the center of everything we do. This plan was built on extensive engagement with staff, patients, families, the public, volunteers, and health services providers. And we continue to engage and report back to the community on our progress, refining the plan as needed to make sure we're getting it right and responding to patients, families, and community needs. To ensure we provide the best possible healthcare experience, we are strengthening our commitment to equity, diversity, and inclusion. We are taking action to create a more culturally safe and compassionate environment to ensure equity for all throughout our hospital and health research institute. Initiatives include mandatory cultural safety and equity, diversity, and inclusion training for all of our staff. As we continue to acknowledge and respect the resilience of Indigenous peoples and communities, opportunities are available for our staff to learn more about Indigenous history, culture, and traditions. These educational opportunities will support our collective efforts towards truth and reconciliation. We will also ensure the inclusivity of the 2SL LGBTQIA+ community and all equity-deserving groups. The implementation of these initiatives will make certain we are providing a positive experience for not only patients and their families, but also for our staff.
We want to create a sense of safety and a sense of belonging for all patients and staff that walk through the doors here. So we did work with the Policy and Procedure Review Committee. So now that when somebody amends or creates a new policy here, they actually have to seek consultation from the EDI Steering Committee to provide that EDI lens to all of the policies and procedures here. They do have a number of subcommittees underneath them, one of which is the Pride subcommittees. They're going to continue throughout the year. They will be working with staff members to ensure that proper pronouns are used for people. People feel more welcomed and accepted when they come through the door. That we're going to take an anti-discrimination standpoint so everybody feels safe. The Indigenous Care Coordinators provide care for inpatients here at the hospital, particularly from a culturally safety lens, where they're able to make Indigenous patients feel welcomed here, but then also post-discharge as they help arrange with their care. Historically, there are issues that can occur within the healthcare system for certain populations, and I wanted to be a part of that change and be a part of the difference.
Providing exceptional care for every patient every time embodies equity, diversity, and inclusion, because in order to provide exceptional care, we have to provide equitable care. Like, everyone needs to be able to access high quality care. It's not just limited though to patient care. It also means that we need to be mindful of equity, diversity, and inclusion in the staff. Having a city that is really welcoming, really supportive, and celebrates diversity, as well as a hospital environment that still has that community feel, goes a long way to attracting people from all backgrounds. I've been very fortunate to be associated with the Indigenous Midwifery Group and to be able to participate and help in all of the excellent work that they've been doing. Initiatives and programs like that can go a long way in terms of making a difference. But I think the biggest thing is that patients come back for care and know that they can receive care here and feel safe doing so, and I think that's the biggest reward for us.
People will come into our hospital, just be who they are and be treated the same no matter what. They're going to receive the health care that they need no matter what. It's going to make them more comfortable, feel safer, knowing that when they're coming here, they're not being judged, they're just being accepted for who they are. So when we smudge, we're just taking that moment to center ourselves, right? To cleanse our minds, to cleanse our bodies, to cleanse our spirits. So it really gives staff an opportunity to take that breath, center themselves, and kind of release some of those energies that might be keeping us down. Some of the main benefits to attending our Repairing the Sacred Circle session would be understanding where Indigenous people are coming from and understanding their intergenerational trauma. These may seem like small incremental changes, but by providing a culturally safe experience for all patients and staff, we are working to foster understanding, community, and safety for all of our patients. Everyone who comes here has the right to receive care in the way that is best for them. While we still have work to do, we are committed to continue to improve our patients' experience and treat each person with compassion and respect. Through these initiatives, we are actively working to embed equity, diversity, and inclusion in everything that we do. When we had the drumming out here just the other day, I had a couple staff come up to me and tell me that they got goosebumps just listening to us sing those songs. Lots of people, regardless of what their backgrounds are, connect with that sort of stuff. So the more we bring these cultural events to the staff here, the more I think that they just want to be engaged more, they just want to learn more, they just want to know more, right? So I think the feedback has been really positive so far.
At the end of the day, I believe a strategic plan is more than an operational roadmap. It's about people, the people we serve, and the people who are there on the front lines helping people day in and day out. It is our North Star, and I am truly proud of Strategic Plan 2026 and what lies ahead for us. We will create a more inclusive experience for all who walk through our doors, because we all belong.